Well, the vaccine rollout is posing some tricky questions for world leaders. Wealthy nations have already delivered millions of doses to their citizens. Meanwhile, poorer nations are getting dribs and drabs. Let's get you some perspective on this. Bring in eNCA's Michael Marillier, who's tracking all the figures for us. And Mike, health officials are saying we're all in this together, but not so much when it comes to the vaccinations.
Yeah, absolutely. It has been very sporadic in some of the world's poorest nations, Tembakile, and the health experts saying that is a big concern. It has been very imbalanced, if you want to put it that way, and you might say that the map is being redrawn when you focus on vaccines around the world. Let's focus on some of the numbers. I'm going to look at the different continents, Tembakile. First of all, I'm going to focus on the population. So Africa's population as a continent, 17% of the global population. Asia, nearly 5 billion people living there. That makes up almost 60% of the world's population. Central and South America, Tembakile, we're looking at around about 8%. In Europe, you're looking at 1 out of 10 human beings on that continent, so about 750 million. And then North America, Tembakile, just 5% of the world's population. So bearing that context in mind, keep an eye on that graph, and we're going to now bring up the vaccine coverage. So in other words, how much of the world's vaccine doses do these continents have? Well, the North American continent, 26% of the world's vaccine doses have been administered in Canada and the United States. In terms of South America, relatively even. So 8% of the world's population, 7% of the vaccine's doses. But take a look at Europe there, right at the top there, Tembakile, that pink continent. We're talking about 20% almost of the world's vaccine doses, but just 10% of the world's population. Asia, 59% of the world's population, 46% of the vaccine doses. So there's a disparity there. But the key number here, Tembakile, is that 2% on the African continent. Remember, 1.4 billion people, 17% of the global population, but so far, Tembakile, just 2% of the vaccine doses administered around the world.
The question then becomes, Michael, how do we fix this? How do we put Africa back on the map, so to speak?
Yeah, very good question. I actually kept track of an analysis a few weeks ago, Tembakile, where Dr. Shabir Mahdi actually spoke about this directly. And he said that Africa needs really to invest in its vaccine development and focus on the ability to manufacture vaccines on its own continent. That way, we won't have to try to scramble to try and find the money to buy these vaccines and try and compete against wealthy nations which are a lot richer than African countries. So let's focus, just to put things in perspective, on the vaccine percentage that these continents have versus their populations. Just to put it in perspective, North America 5 times in terms of the vaccine percentage when you compare it with the population percentage. Europe, Tembakile, as I mentioned, 2 times bigger. In other words, the percentage of the vaccines that it has compared to the percentage of the global population. So double effectively what it should have. When you look at Asia, like I said, a bit of a discrepancy there, 1/5 smaller than the population percentage. But again, if we focus on Africa, Tembakile, our continent is effectively 9 times smaller if you focus on the vaccines that it has compared to the population that it has. So the key thing here, Tembakile, many experts saying we need to invest in vaccine development on this continent. That way we don't have to compete with richer nations to such an extent, and we don't face the same kind of crisis that we've seen with COVID-19.